Welcome to the deep dive. Today we're tackling a behavior that, well, if you've been around horses much, you've probably seen it. Cribbing.
Yeah, absolutely. And it's often just dismissed, isn't it, as a stable vice, just a bad habit the horse picked up somewhere.
Right.
But, when you really dig into the expert guides and the research on equine behavior like we did for this deep dive, it turns out it's, well, surprisingly complex. It's got really deep roots.
Totally. Like you, I kind of thought, oh, it's just a quirk,
Hmm.
like someone biting their nails or something. But the sources we went through, wow, they just peel back layers I never even considered.
Mm-hmm.
So our mission today is basically to cut through those assumptions, get past the surface level, and pull out the really crucial stuff from all this material. We're going to unpack what cribbing is exactly,
Mm-hmm.
why horses do it, the impacts, and importantly, what we can actually do about it.
Yeah, think of it as getting you up to speed quickly but thoroughly, based on what the science is telling us now.
Exactly.
Mm.
Consider this your fast track to really getting cribbing.
And it's a classic example, really, of what behavioral scientists call a stereotypy.
Okay, stereotypy. What does that mean exactly?
It's basically an abnormal, repetitive behavior. It looks kind of purposeless, like it doesn't have an obvious function.
Yeah.
And seeing one often signals something pretty significant about the horse's environment or maybe their internal state.
Okay, right. Let's unpack that. So first things first, let's make sure we're picturing the same thing. What does cribbing actually look like?
So the classic action is the horse grabbing onto something fixed. Could be a fence rail, stall door, edge of a bucket,
Yeah.
anything stable really with their top front teeth, their incisors.
Okay.
Then they arch their neck. You'll see the muscles underneath engage. They pull back. And there's often this distinct grunting or sort of gulping sound. People think they're swallowing air.
All right, I've heard that. Windsucking.
Yeah, but the research suggests they actually take very little air in, if any. And that brings us to an important difference the sources point out, cribbing versus windsucking.
Ah, okay. They're not the same thing then.
Not quite. The key is that grip on the object. Cribbing requires biting onto something. Windsucking involves a similar neck arch and sound, maybe. But the horse does it without latching onto anything, sort of in midair.
Got it. So the object grip is the defining feature of cribbing. And you mentioned it's a stereotypy, this abnormal repetitive thing. One stat that really jumped out from the sources was how common it is in domestic horses, like 5 to 15%.
Yeah, somewhere in that range. It varies a bit study to study, but it's definitely not uncommon.
But then the contrast is stark, right? You look at wild or feral horses.
And it's incredibly rare, almost non-existent. You just don't see it much, if at all, in horses living naturally.
And that right there feels like the first big clue, doesn't it?
Absolutely. That difference screams that this isn't some innate hardwired thing.
No.
It strongly suggests it's linked to how we manage horses,
Yeah.
our domestic environments.
Which, okay, leads straight to the big question. Why? If it's not natural, what makes a horse start doing this? It can't just be for kicks, ruining fences.
Exactly. And the sources are really clear on this. There's no single answer. The why is complex. It's multifactorial. Lots of things playing together.
Okay, so let's break those down. What about the behavioral and environmental stuff the sources mentioned? That seems like a logical place to start.
Yeah, it's fundamental. You have
Yeah.
to think about what a horse is. They're highly social, evolved to graze for like 16 hours a day, moving around in herds.
Right, not standing in a box alone.
Precisely. So being confined for long periods, not having enough forage to chew on constantly, limited social interaction, not enough turnout time, these things are totally counter to their natural state. And that creates, well, boredom, frustration, stress.
Makes sense. And stress itself is a trigger.
Oh, huge. Any kind of anxiety or stress can contribute. Changes in their routine, moving barns, new horses arriving or leaving, even just inconsistent handling, anything that makes them feel insecure. Weaning is another big stressor linked to it.
But what about the idea that they learn it from each other? Is that a real thing?
Well, the sources suggest it's maybe not as simple as direct copying. While it's, theoretically possible one horse might mimic another, it seems pretty rare.
Ah.
A more likely explanation, if you see multiple horses cribbing in one barn, is that they're all experiencing similar stressors, maybe the diet, the lack of turnout, whatever it is, that are independently triggering the behavior in each of them. Isolation, for example, is a known factor that can induce it, not necessarily direct learning.
Okay, so environment, boredom, stress, all big factors. But then the sources really zeroed in on a connection to the gut, didn't they?
Yes, this is a really significant area of research highlighted in the sources. There's a very strong association between cribbing and gastric ulcers.
Ulcers, wow. How does that work?
One leading hypothesis, and it's quite compelling, is that the physical act of cribbing might actually stimulate saliva production.
Saliva. Why is that important?
Because horse saliva contains bicarbonate, which is a natural buffer against stomach acid.
Ah. So it's like the horse is trying to give itself a Rolaids or something, trying to soothe its stomach.
Potentially, yeah. It might offer some temporary relief from the discomfort caused by excess stomach acid or existing ulcers. It becomes a coping mechanism for that physical discomfort.
And diet plays into this gut connection, obviously.
Massively. Modern feeding practices often involve high amounts of grain or concentrates and maybe not enough hay or long gaps between meals. This is the opposite of their natural trickle feeding pattern.
Right, they're designed to graze constantly.
Exactly. So high-starch diets and infrequent meals can increase stomach acidity, raising the risk of ulcers. This creates the very discomfort that cribbing might then become a way to manage or try to alleviate.
Okay, this is fascinating. So we've got the environment, stress, boredom, and this really strong gut health link related to diet. But then, this is where I thought it got really interesting. The sources started talking about deeper biological stuff. Genetics, neurobiology, suggesting it's more ingrained than just a habit.
Yes, this is where the understanding really shifts. The research is increasingly framing cribbing as something closer to a compulsive disorder, like you might see in humans or other animals.
Compulsive. How so?
Well, first, there's pretty good evidence for a genetic predisposition. Some breeds just seem more prone to it. Thoroughbreds, quarter horses, warm bloods often get mentioned, and it definitely runs in family lines.
So some horses are just born more likely to develop it.
It seems that way. Researchers are even starting to pinpoint specific genes, potentially involved genes related to things like appetite control, stress response, the brain's reward pathways.
Wow.
Yeah, they're drawing parallels to the genetics of compulsive behaviors in other species. It's really complex biology.
So genetics might sort of load the gun, but it's the neurobiology, the brain chemistry, that pulls the trigger and keeps it firing.
That's a really good analogy because the act of cribbing itself seems to trigger the release of endogenous opioids, think beta endorphins, in the horse's brain.
Endorphins.
Yeah.
Like runner's high.
Exactly like that. These are the horse's own natural feel-good chemicals. They create a sense of pleasure or calmness, maybe pain relief. It acts as a kind of internal reward.
Whoa. So they literally feel better chemically when they do it. That explains a lot.
It really does. And that positive sensation powerfully reinforces the behavior. It becomes self-soothing. Plus, the brain's dopamine system, which is all about reward, motivation, habit formation, also seems to be involved, potentially getting dysregulated in cribbers, making the behavior feel even more compelling or necessary. Like an addiction, almost.
So it becomes this learned loop in the brain.
Pretty much. And interestingly, while cribbers might have higher baseline levels of stress hormones like cortisol, studies show that the act of cribbing can temporarily lower their heart rate and cortisol levels.
So it does reduce stress, at least for a moment.
In that moment, yes. Which again reinforces it as a coping strategy that the brain latches onto, even if the underlying stressors aren't resolved.
That's incredible. It's not just a reaction, it's this ingrained neurobiological feedback loop providing actual relief. Okay, let's shift gears slightly. What about the consequences? Beyond just seeing the behavior, what does cribbing actually do to the horse physically and otherwise over time?
Right. Besides just seeing them do it, there are definite physical signs you can look for. One of the most obvious is wear on the incisor teeth, the front ones.
Because they're constantly grabbing onto things.
Exactly. That constant pressure and friction on hard surfaces like wood or metal literally wears the teeth down. They can become flattened, angled.
I bet that causes dental issues down the line.
It certainly can. It might make it harder for them to graze properly or even eat hay efficiently. It often requires more frequent dental care.
Okay, what else?
You'll often see developed muscles under the neck. It's sometimes called ventral hypertrophy by vets. Basically, those muscles they use to arch their neck and pull back get overdeveloped from the constant repetition. They can look visibly thicker or bulge.
And what about actual health risks? The sources mentioned colic, which is always scary.
Yes, there's definitely an increased risk for certain types of colic associated with cribbing. While the old idea of them swallowing huge amounts of air causing simple gas colic is debated, the research does point to a concerning link. though the exact mechanism isn't always clear with more serious types of surgical colic.
Surgical colic. Like what?
Things like epiploic foramen entrapment, which is where part of the intestine gets trapped, and also certain issues with the large colon, like impactions or twists. These are major life-threatening emergencies.
Wow, okay. That's a really serious consequence.
It absolutely is. And then there's the ulcer connection we already talked about. Ulcers can be both a cause and potentially an effect, or at least worsened if the cribbing interferes with eating patterns.
Right. The cycle continues.
And some sources also mention a potential, though maybe less common, link between that chronic neck muscle tension and something called temporohyoid osteoarthropathy, or THO. Yeah, it's a condition affecting the joints and bones near the base of the skull and the middle ear. The idea is the constant strain might contribute to problems there, which can cause neurological issues.
Yikes. And just practically, if they're spending all their time cribbing.
They're not eating, right? In severe cases, horses can spend so much time cribbing, especially around feeding time, that they just don't consume enough calories. This can lead to weight loss, poor body condition, lack of energy, impacting their overall health and ability to perform.
So the health implications are significant. But it doesn't stop there, does it? The sources mentioned practical, almost financial impacts, too.
Oh, definitely. Cribbing horses can do a surprising amount of damage to property. They chew on fences, break boards, damage stall doors, water buckets, feed bins. The repair bills can really add up over time.
I can imagine. And it affects the horse's value.
Significantly, an established cribber is almost always worth less on the market. They can be really difficult to sell or even rehome because people are wary of the behavior and the potential damage or health issues.
And finding a place to board them can be tough, too, right?
Yeah, that's a big one. Many boarding facilities simply won't take cribbers. Partly because of the property damage risk, but also because of that lingering, though, as we said, largely unsupported fear that other horses will just copy the behavior. There's definitely still a stigma around it, unfortunately.
Okay, so it's a complex picture with real consequences. If someone thinks their horse might be cribbing or starting to, how is it usually assessed? What's the process?
Well, diagnosing the behavior itself is usually straightforward. You see the horse doing it.
Right, observation.
Yeah, but the assessment needs to go much deeper than just saying, yep, it's cribbing. The real goal is to try and figure out the underlying reasons why this horse is doing it and to assess how it's affecting their health.
So what does that typically involve?
It really starts with a super thorough history, talking to the owner or manager about everything, the horse's daily routine, their diet in detail, turnout schedule, social situation, any recent changes or stressors, how they were weaned, all that background.
Looking for those potential triggers.
Exactly. Then a good physical exam is key. Checking for those telltale signs like the tooth wear, the neck muscles, but also assessing the horse's overall body condition and health.
And given the ulcer link.
A gastric endoscopy scoping the stomach is often highly recommended. That's the only way to definitively diagnose ulcers. A really detailed dental exam is also crucial, not just for wear, but overall mouth health. And sometimes, depending on the case, maybe some imaging if other issues like that THO thing are suspected.
Okay, so you've identified it, you've done the assessment, hopefully figured out some contributing factors. Now, how do you actually manage it? The sources seem pretty clear that just stopping it completely is, well, unlikely.
That's a really critical point to understand. Once cribbing is a well-established, ingrained behavior, especially with that neurobiological component, complete elimination is, frankly, rare. Significant reduction is often achievable, though.
So it's about management, not necessarily a cure. Exactly, and management needs to be multimodal. That means tackling it from several angles at once, addressing as many of those potential root causes as possible. And honestly, prevention is where the real power lies. It's much easier to prevent than to manage once it starts.
Right. We'll get to prevention. But for a horse that's already cribbing, where do you start with management? Let's talk about addressing those root causes, environment and diet first.
Absolutely, because this is often the most impactful area. The #1 recommendation across the board is maximizing turnout. Ideally, 247 pasture access with compatible companions.
Letting them live more like horses.
Precisely. It directly addresses boredom, lack of movement, social isolation, and allows for natural grazing. If 2047 isn't possible, then as much turnout as feasible. Environmental enrichment can also help things like slow feeders, toys, maybe even mirrors in some cases, just to provide more stimulation.
And minimizing stress.
Crucial. Keeping routines consistent, using low-stress handling methods, making any necessary changes gradually.
Okay, and the diet part can expect the gut health, right?
Yeah. Yes. Maximize forage intake. That means providing access to hay or pasture pretty much constantly. This keeps their gut working properly, satisfies their innate need to chew, and the saliva produced helps buffer stomach acid. Slow feeders can help stretch out hay consumption.
And reduce the grain.
Definitely minimize concentrates, especially those high in starch and sugar. If concentrates are needed for energy, feed small amounts more frequently rather than one or two big meals. This mimics their natural grazing pattern much better.
And if ulcers are found?
Then treating those is paramount. Using medications like omeprazole as prescribed by a vet is key. Supporting overall gut health with things like antacids, buffers, or maybe probiotics might also be part of the plan to remove that potential source of discomfort driving the cribbing.
Hey, that makes sense. Tackle the environment, the stress, the diet, the gut. Now, what about those physical things people often reach for first, like cribbing collars?
Right, the deterrence. Things like cribbing collars or straps work by applying pressure under the neck when the horse tries to flex those muscles to crib. Cribbing muzzles physically block them from grabbing onto surfaces.
And do they work?
Well, they can physically prevent the horse from performing the action while the device is on and fitted correctly. But, and this is a huge, but the sources emphasize they do absolutely nothing to address the underlying motivation or need for the horse to crib.
So it starts the behavior, but not the urge.
Exactly. And because cribbing is often a coping mechanism for stress or discomfort, preventing that outlet without addressing the cause can actually increase the horse's internal stress or frustration. It's like taking away someone's coping mechanism without helping them with the anxiety causing it.
That's a really important perspective.
Yeah.
What about other physical things?
You can modify surfaces, putting metal caps on ledges, running electric wire along fences, removing common grabbing spots. These can deter them from using certain locations. Aversive sprays or paints are sometimes mentioned, but generally they have limited success for cribbing itself, maybe more for simple wood chewing, because the taste isn't usually the primary driver for cribbing.
And are there medical or even surgical options?
They exist, but the sources generally position them as secondary options or last resorts, and their success rates are variable.
Like what?
There are some behavioral medications that target those brain chemicals we talked about, opioid antagonists, dopamine antagonists, the SSRIs. They've been explored, but the results are really mixed. They can have side effects, and they're not usually seen as a long-term, standalone fix.
And surgery. That sounds drastic.
It is. The main one is called a modified Forsell's procedure. It involves surgically cutting some of the specific muscles and nerves in the neck that the horse uses to perform the cribbing motion.
Does it work?
It can reduce or sometimes eliminate the physical act in some horses, but success isn't guaranteed. It's an invasive procedure with potential complications, and again, it doesn't touch the underlying biological or environmental drives. It's typically reserved for very severe cases where the cribbing poses a significant health risk, like causing recurrent dangerous colic. And it's worth noting, another procedure, bacostomy, is basically condemned now due to welfare concerns.
So it really keeps coming back to managing the horse's whole world, doesn't it? Trying to align it better with their fundamental needs.
Fundamentally, yes. That's the core message from the sources. Addressing the environment, the diet, the social needs, the underlying stress and health issues, that's the foundation. Physical deterrents or medications, if used, need to be part of that bigger picture, not just a quick fix attempt.
Which leads us perfectly back to something you mentioned earlier, prevention. The sources really hammer home that preventing cribbing in the first place is far, far more effective than trying to manage it once it's established.
Absolutely. If you can avoid the conditions that set a horse up to start cribbing, you're way ahead of the game.
So what does effective prevention look like, based on the research?
Well, genetics plays a role, so where possible. Maybe considering the cribbing history in breeding lines could be a factor. But the biggest levers are really in management, especially early life management.
Like how they're weaned.
Yes, that's highlighted as critical. Using low-stress, gradual weaning methods, perhaps group weaning, where foals stay with peers, seems much better than abrupt, isolated weaning. Also, providing early and consistent access to pasture, plenty of forage, opportunities for social interaction with other horses, and general environmental enrichment right from the start.
Building resilience early on.
Exactly. Setting them up with good coping skills and a species-appropriate lifestyle from day one. Maintaining that focus on high forage, low concentrate diets throughout their life is also key for gut health and natural behavior. Minimizing stressors wherever possible is obviously important.
And being vigilant.
Crucially, yes. Recognizing the very first signs that a young horse might be starting to experiment with cribbing-like behavior and intervening immediately by addressing potential stressors, checking diet, increasing turnout, etc., can make a massive difference. Catching it before that self-reinforcing neurobiological pathway gets deeply established is potentially the most effective treatment there is.
Wow. Okay, this deep dive has definitely shifted my perspective. What looks like, just a simple annoying habit is actually this incredible intersection of genetics, gut health, brain chemistry, and how the horse's environment interacts with all of that.
It really is fascinating when you pull all the threads together from the research, isn't it? Seeing how this one behavior reveals so much about the complex interplay between an animal's internal biology and the external world we create for them.
Yeah.
It really speaks volumes about animal welfare.
And how human management practices can have these really profound multi-level impacts on their biology and behavior.
It definitely highlights the challenge, of understanding and managing these kinds of complex, almost compulsive behaviors. And it underscores why it's so vital to look beyond just the symptom, the cribbing itself, and really dig into addressing the root causes.
It gives anyone involved with horses, or even just interested in animal behavior, a much richer, more informed way to think about it. So if we were to boil it down, the big takeaway here is pretty clear. Cribbing in horses is way more than just a bad habit. It's this complex behavior driven by a whole cocktail of things.
Yeah.
Genetic tendencies, yeah, but also changes in brain chemistry providing relief, gut issues like ulcers often linked to diet, and critically, environmental factors like being cooped up, bored, stressed, things that clash with how horses are naturally meant to live.
Right, and because it's so complex, managing it effectively means you can't just slap on a collar and hope for the best. It needs a multi-pronged approach, really focusing on fixing those underlying issues, the environment, the diet, the stress, the gut health, trying to meet their natural needs as closely as possible.
In prevention, especially through really thoughtful management right from the start, providing that species-appropriate lifestyle. That's our most powerful tool.
Absolutely. Which leaves us with maybe a final thought for you to chew on. If cribbing is, at its core, a coping mechanism, a biological response to the stresses often imposed by our human management systems, what does that really tell us about our responsibilities when we care for these incredibly social, active animals, especially in environments that might limit their natural behaviors?
It's a heavy question.
And maybe even could understanding this complex interplay of biology, behavior, and environment in horses offer some surprising insights into similar compulsive behaviors we see in other species, maybe even in some ways reflecting patterns in ourselves.